Hi, my name is Jamie Granzella, and this is my informative speech for Intro to Public Speaking. I will be giving my speech based on childhood social, emotional, and behavioral disorders. In the United States, several students are diagnosed yearly with social, emotional, and behavioral disorders. Disorders such as ADHD, anxiety, bipolar, and even autism. But are these caused because of the environment that a child grows up in, or is it because of their genetics, or is it because of both? Is there anything that we can do to prevent these disorders, and what can parents do to help children that have already been diagnosed? According to the Center for Disease Control and Prevention, from 2005 to 2011, the children that were aged 3 to 17 that were reported to have ADHD was 6.8%. Anxiety was 3.0%. Bipolar disorder was 2.1%. And autism spectrum disorders, including Asperger's, autism, Fragile X syndrome, and obsessive compulsive disorder, was 1.1%. According to the Journal of Psychology and Psychiatry, Child Psychology and Psychiatry, ADHD and autism leave little room for environmental influences. Basically meaning that these are caused because of genetics, but that the environment can still be a factor. There is some speculation that moms who have complications during their pregnancy or smoke during their pregnancy could cause ADHD in their child. In that same article, many genes will act by modifying the organism's response to particular environmental influences. So ADHD and autism spectrum disorders can be caused by both genetics or the environment. Anxiety, they have no idea what causes anxiety in children. Bipolar disorder is primarily based because of genetics. According to WebMD, children with one biological parent that has been diagnosed with bipolar 1 or 2 has an increased likelihood to also be diagnosed with bipolar disorder. While there is no cure for these disorders, there are some preventative measures that can be taken to help lower the possibility of a child born or diagnosed. Mayo Clinic staff said to help prevent ADHD during pregnancy, don't drink, don't smoke, and or use drugs. Avoid exposure to environmental toxins. Mayo Clinic staff also stated there's no way to prevent autism. But according to the WebMD website, to reduce the risk of having a child with autistic disorder, don't take drugs during your pregnancy. This is especially true for seizure medications. Information for anxiety and bipolar disorders show there isn't a way to actually know what causes either one of these disorders. So, therefore, there's no way to prevent them. For many parents that have children with a disorder, they feel like they are trapped. And many of these disorders require medication, but there are also programs and counseling groups to help parents and children cope with the disorder. Children that have been diagnosed with ADHD usually require medication to help keep their focus, in addition to keeping routines. Teaching in smaller groups is also very helpful. In the Clearinghouse January-February edition 2009, Friedlander tells how to help autistic children feel more at ease in a classroom. Also, keeping routines with autistic children is beneficial. Before school starts, having the child come in routinely to get accustomed to your classroom. Keep the lines of communication open with the child's parents. They are your greatest ally, and they know that child the best. For anxiety, there is medication that can be given to children to help control their emotions. According to the WebMD website, treatment for bipolar disorder is most often a combination of a mood-stabilizing drug and psychotherapy. So, in conclusion, while there are no cure for any of these disorders, there are medications that can help to alleviate the symptoms. There are also therapeutic techniques that can be used to help children with their fears and anxieties and create positive reinforcements for them. These disorders are caused by both genetics and environment that a child was raised in, creating the growing rate for these disorders. Thank you, and have a nice night.